Hello everyone, welcome back to my channel. My name is Shafick. I am a medical doctor from Honduras. My clinical grade up to now would be more of a starting F4, which means I did my internship, my F1. I worked as an F2 already. I've been working for 1 year after my F2. So I finished my F3, if you want to put it that way. In Honduras, it's a bit different, but if you guys are applying to the UK, I just want to make this video kind of relatable to you. What do I do? Well, I work in general internal medicine, in outpatient clinic of general practice as well, and sometimes I do locums in the A&E, as well as in internal medicine and pediatrics ward. Sometimes I rotate with anesthesia in the operating room. And as you can see on the title of this video, very happy to let you know that I passed my PLAB 2. So pretty much I finished all my requirements to get my full registration with the General Medical Council, with the GMC, and also get my license to practice, as well as apply to my first jobs, apply to residency, apply to a training job, which is the way how it is called in the UK. So if you're watching this for the first time, you still don't know about the structure of the PLAB 2, I'm gonna try to simplify it to you. It is a really confusing exam. It was so different to any other type of exams I had ever done in med school, so I couldn't relate it to anything. I had never had any type of OSCEs exam, any type of clinical practical simulations going in, having an actor portraying a patient, or having a mannequin to whom I had to speak to as if it were a real patient. Medical education here in my country is very, very different than in the UK. Saying that, I have to appreciate a lot all the opportunities and learning chances I've gotten while studying medicine and while working as a doctor in my country. But I had a big learning curve preparing for this exam, which is nowadays called the ukmla. The PLAB 2 is a CPSA. What does all of this mean? You can see it in your screens. It's pretty much a clinical and professional skills assessment. They just want to see that you are a well-trained doctor, that you have enough knowledge, that you know how to do procedures, how to examine a patient. But more importantly, the PLAB 2 is not about medical knowledge itself. It's quite tricky because what they want to test is how good you are with a patient, like the human side of medicine, how good you can communicate with a patient, how well you can conduct a counseling station, how well can you deliver bad news to someone, or confront a colleague who is having a problem, or they report a colleague of yours because of X and X actions and you have to speak to them. The most important part of this exam is on the interpersonal skills. So the PLAB 2 is a practical exam. It has 16 stations. Each station lasts about 8 minutes. You hear different type of bells, let you know when you only have 2 minutes left, when you need to move on to the next station. In between the stations, you have about 90 seconds to be able to get out of your chair, leave the room, close the door, move on about 5 to 10 steps to the next door. And outside the door, you have a paper which tells you the scenario. So something like you are an FY2, your patient is John Doe, he's 59 years old, comes to the A&E because he has been having fever, shortness of breath, and he just feels awful. And it's worth mentioning that during the exam, you have 2 resting stations. It's the same protocol, 8 minutes of rest. You might have a cup of tea, you might drink water. You have some snacks there so that you can kind of relax a bit. I'm gonna be honest with you, on my first break of the exam, I actually went to the bathroom and I had to wash my face because I felt I was doing a horrible job. I almost wanted to cry. I wiped off more or less tears from my eyes. I felt so stressed. But after that, I felt more calm. I was able to kind of therapy myself, like, come on, man, assume this is not an exam. Think that you're just gonna see patients as you regularly see in your day-to-day life in Honduras. And that kind of helped me relax and feel like, you know what, I've been a doctor for quite some time. This is something I do routinely. And yes, this is an exam, but I just have to treat them as real patients, not as actors. And having that change in mindset, but if you can get ready for that and prepare yourself to see real patients instead of seeing them as actors, it kind of changes the tone for the consultation and how confident you feel in yourself and in the exam itself. They are evaluating you on 3 different domains. They want to know how well you are with data gathering, so asking the patient for how long have they been feeling awful, what is their past medical history, do they take any medications, any family history, how is this affecting their life, how would they rate their mood, all these sort of different questions to know better your patient. And also in some of the stations you are going to actually perform a physical examination, so that's part of the data gathering. Sometimes you just have to verbalize, I would like to listen to your lung sounds in your chest, would that be okay? And the patient, yeah, it's okay. And when you're about to stand up to perform the examination, maybe the person that's there tells you, it's not necessary, doctor, here are the findings, and they give you a sheet of paper which might say lungs are clear to auscultation bilaterally, or something like that. So that's the first domain, data gathering. Your second domain is management. They want you to say the following things. Thank you for allowing me to examine you and for answering all of my questions. So, and you give a small recap. So you told me you have been coming with some fever, shortness of breath. This has been going on for more or less 3 days. As past medical history, you have been diagnosed with COPD and you're using regular inhalers, but you feel that this past days you have not felt quite right. So based on all of these things, I think you might be having a COPD exacerbation. You might be having a chest infection, which is worsening your base symptoms of your COPD. Does this make any sense up to now? And the patient, oh yeah, doctor, that makes sense. So what are we going to do? I would suggest running this blood sample, sending this investigations, requesting a chest x-ray. I will consult with my senior to see what is the best antibiotic choice for your possible infection. We'll determine if you need a medication called a steroid to kind of make your lungs get less swollen and allow you to breathe better. And for that, I would like for you to stay in the hospital, or I would like to treat you in the outpatient setting and see you back again in some days. All of these things. So they want to know that you actually know about the disease, you know the basics of the treatment, or that you know when to refer a patient to another level. If you have noticed, I have introduced certain phrases into there to build rapport with the patient, to make them feel comfortable that they are in good hands. That's what the GMC wants to know. How safe of a doctor you are, how empathetic you are, how comfortable you make your patients feel, and how good you can get this verbal and non-verbal cues on the patients. So you're being assessed on these 3 domains in all different stations, whatever they are. These 3 things are the criteria to know whether you pass a station or not. You can get up to 4 points in each of the domains, and usually the passing score of each station is determined according to the average or the mean grade of the whole group taking the PLAB on the day that you are taking it. However, to actually pass the exam, you need to pass at least 10 stations, and usually, according to, once again, the average grades and points of the group, they will tell you, yeah, you need 10 stations and you need to score at least 91 points in the exam. So if you have all this amount of stations and you can get up to 12 points in each one, technically, it wouldn't be hard to get at least 100, 110 points. So let's say that you actually passed 11 stations and the passing score was 91, but you scored 90, even though you passed the 10 stations, you are going to fail the exam. So that's where the tricky part is. It's not only passing 10 stations, it's actually getting a good enough score in all of your stations. Even though you might fail a station, if you get a decent score there, it's going to elevate your average and maybe you're going to be able to pass the exam that way. Now, regarding the type of stations that you might get, you have clinical stations, your basic, yeah, what brings you to clinic? Okay, we're going to give you treatment for this, or we're going to send investigations for this, or maybe you get a follow-up and somebody already ran some labs on your patient and you just need to see them back, see how they are doing, read the labs for them and tell them what are the next steps on their treatment or their prognosis. You have counseling stations, like patients coming in and asking you about how to change their lifestyles or what type of modifications they can do to be able to lose some weight, etc. You have different counselings there. You have breaking bad news, which is one of the most difficult stations, which is when you tell a patient they might have cancer, when you tell a daughter that their father is not going to survive the traumatic brain injury they just had in a car crash, or you tell someone that their little kid has leukemia. They want to evaluate how good you are with this, how empathetic you can connect to the patient, and how well you're actually to deliver this news. So you have the breaking bad news. You have psychiatry stations where you counsel about depression, anxiety, sexual abuse. You counsel bullying on LGBTQ patients, to give an example. You might also have some teaching stations, like having a medical student in the room with you, a medical student, and then wants to know more about EKG or how to read an X-ray or how to inject subcutaneously So you have to teach them, and if you have equipment there, you need to use it and teach them how to use these little things like an EpiPen, for example, or how to do a urine dipstick sample. You have physical examinations, like you have a patient that comes in because they have been having blurry vision on their left side, they've been having some fevers, you live with a lot of cats, you're suspecting of toxoplasmosis. You will actually have a mannequin, like a head mannequin for you to do a fundoscopy and do all the technique, explain everything, take consent from the patient, explain your findings, give treatment, give diagnosis, all of that. You might have to do procedures like putting IV cannulas, or how to take blood cultures, how to take a regular blood sample, how to put in a Foley, these type of things. Two most difficult stations are the emergency stations A, B, C, D, E, which is famously called SIM-MAN, simulation mannequin stations. You have a real huge person-like mannequin and they come in with an acute problem, like for example an anaphylactic reaction. And the last station is prescriptions. So the UK has a small book called the BNF, which has all the medications they use, all the typical doses, contraindications, any risks, interactions with other medications, etc. So they usually tell you, hey, you need to give them this antibiotic. So write down the prescriptions for this admitted patient, and you have the real admission sheets where you put medications, you put IV fluids, you put all of these things. And if you have never worked in the UK, this is actually really, really challenging. So it can be quite tricky. But this is the base structure of how the PLAB2 works and how they are going to evaluate you. Now the exam only takes place in Manchester in the United Kingdom, and it pretty much happens every single week, more or less 2 or 3 days a week. It's really expensive. It's almost £1,000 for the exam, plus paying for your travels, requesting a visa, paying for your visa appointment, all your expenditures while being there. And if you're going to an academy, then that's going to be expensive as well. Now that we covered how the structure and how the exam works, I'm going to stop this video right here because I don't want to make a humongously long video. And we're going to make a part 2 where I talk about what was my strategy or my approach to study, what kind of academies or resources you might use for studying for the PLAB exam, and how I would use them based on a specific objective. So please stay tuned, share this video, and I'll see you around more or less 1 week where I post the next video. So I'll see you there. Bye bye everyone.